There has been some suggestion that these additional savings are as a result of the settlement with the doctors. And those two things have been connected up. I would like to stress that those two things are completely not connected. These savings have been ongoing and obviously were part of a suite of measures and agreed at the beginning of January. The additional funding which was provided to Manx Care in order to negotiate what was a settled position with the doctors, that has come from the Department of Health and Social Care. So that is not from within the Manx Care budget. Manx Care was always clear what it could afford to offer doctors, and it couldn't breach that. And so we have managed to settle, but obviously with additional support from the DHSC.
Just on that, are we able to get a confirmation of how much extra money this is? Because the Minister's spoken, Tim Walden didn't give a figure and didn't really explain where this money was coming from either at the time. It's sort of gone around. That's the first time that we've been told where this money's actually come from. Do we have how much that's actually going to be? So
we're still working through the final figures, but it's around 2.2 million to sort of the extra, and then approximately the same amount moving forward on a recurrent basis that will need to be brought into the baseline. We're still working through that details, but that's the indicative numbers that we have worked with in terms of reaching resolution with the BMA. I genuinely wouldn't want those two things to be connected. Our doctors deserved and negotiated a better pay settlement, and cuts to services, reductions in services are not being enacted in order to fund that. And I think I want to make that really clear.